So today we're going to be doing Zeltique, or CoolSculpting, which is essentially cryolipolysis, or a freezing of fat. It's a technology that's FDA approved for the treatment of the flanks. But in this case, with our patient today, she's a young female that has had 2 children. But because of that, she started to deposit fat over her bra area. And so she has this bra roll that she doesn't like, and she's otherwise very small, and she can hide, you know, other little fat deposits, but this area she's not able to conceal as well. And I think as women, we all know that we don't really like that area when it bulges. And so today with her, we're going to be doing CoolSculpting, which is a 1-hour procedure to essentially treat both bra fat pads. We have 2 devices here in the practice, and so we're able to treat both sides at the same time, essentially cutting the treatment in half. And so patients prefer that for the purposes of time management and being able to get on with their careers. And so with her today, I'm going to essentially show where we're going to be treating her, and you can see how it's going to look afterwards. So you can see that there's really no downtime. We're going to essentially be applying the Cool Curve Plus today to optimally treat her bra fat pad. And so essentially this is a very comfortable procedure, and that's why patients like to elect it versus liposculpture, which we also do here at the practice, because it takes an hour if you're treating, you know, 2 areas, and there's no downtime for the procedure. Granted, it's meant for patients that are within their ideal body weight and would be okay with just having a 20% reduction in the treated area, versus tumescent liposculpture, which allows you to get more fat reduction and allows you to cover more areas if you have more generalized fat deposition. But in someone like her who has it very localized, we're going to use CoolSculpting instead. And so here we are. Take a nice deep breath in and exhale. And so that's the application. And so how does it feel?
Good.
Good. Are you comfortable?
Yes.
And so that's essentially what she's going to be feeling today. After the procedure, we give a nice massage, which we'll be showing, and the patients go about their daily routine. There's no downtime from this procedure. What's nice about CoolSculpting, and the reason it works, is because fat freezes at a higher temperature than the skin does. And so we're able to freeze the fat without injury to the epidermis. And so we're selectively targeting fat cells. So it's a very intelligent technology, and patients in our practice have benefited greatly from it. So we just finished the treatment with our patient, and as you can tell, she's just slightly pink in the treated area. But essentially that'll go down within the next 24 hours. And patients generally only complain of a mild tingling, loss of kind of sensation in the area that takes place for about 2 to 3 weeks after the procedure, and that resolves on its own. And then over the 4 to 6 weeks following the procedure, she'll start to show the signs of fat reduction. And again, most studies have shown that you can have ultimately about a 20% fat reduction after just 1 treatment. We can always go over the same treated area again to get more reduction if needed. But in her case, I think 1 treatment will do just fine.